You're about to have your second round of stem cell injections and you're wondering, how do I approach my rehab? Does it change from my first set of injections? Well, I'm going to explain that in this video. My name is Dr. Garcia. I'm a leading expert in stem cell recovery. I'm excited to help you through this second round and get you on that path to feeling better towards that final destination. So if you've had a second round of injections, you've been determined that you need this second round to get you to that last phase, to be able to help improve your outcomes that much more. Now, as you approach your second round of injections, one of the biggest questions I get is, what changes during this timeline? Does it last another 6 months? Is this going to be the same? Is it more aggressive? Well, for most people, they're going to receive the stem cell injections, and if you've done your rehabilitation and your recovery properly, you're probably around that 6-month mark, and a second round of injections happens around that same time as well. If you've done a proper rehab progression, you know that it was a step-by-step progression to get there. Well, that second round, the only thing that changes is you can expedite one phase of that rehabilitation process. Now, after you receive your injections at the 6-month mark, you're likely going to wait the 2-week mark to see a physical therapist. You're going to start the normal motion and mobility in those first 4 weeks because there's a lot of inflammation happening into your body. It happens around that 6-week mark on what determines the next phase and how your body responds. If you go conservative and you've had a negative response to rehab and maybe your body inflames with a lot of movement, that next phase for you is going to be slowly gaining a little bit more strength versus going right back into higher level physical activities. So at the 6-week mark, after your second round of injections, you should be working on developing light strengthening. And for some people, they won't be able to tolerate that. So they're going to stay in the motion and mobility phase for one more round. This puts you around that 10 or 12-week mark, so that 3-month mark where most people are starting to add more resistance training, maybe even going to the gym. Those who've had a good response and haven't had any issues can start that gym phase at that 12-week mark, meaning you can start to gently lift weights or add a little bit more resistance. For those who have had a conservative approach in that your body did not tolerate a lot of physical stress or trauma, you're going to delay this another 4 weeks. So if your body did well in that first phase and you did everything properly for those first 6 months, the next phase of healing will only take you about 5 months. Now, here's the dilemma. We say, well, I'm just going to replicate or duplicate the first 6 months and I'm going to try it on my own. Well, the problem is that it's not the same. Why? Because in this second round, this is where you start to get into all the functional activities that you wanted to, whether that's jiu-jitsu or golf or pickleball or softball or tennis. And that is an art to get you back. So you're going to need a little bit more of a progression, step-by-step progression to get you into functional activities and fitness. In the first 6 months, the first 3 months were just purely to get you on mobility and stretching. Then we slowly increased your resistance, and then we got you in the gym at month 4. We got you in your physical activities at month 5, and you only had a month to enjoy that. Well, you can't just go from physical activities to injections to go right back to where you started. You do need to start from the beginning, but we can expedite some of these things. So the last 6 months is really getting you back to running, getting you to all the high level activities that you wanted to. The reason why that you got these stem cells, this is it. This is the culmination of everything coming together. So you don't want to shortchange this. You still want to stay with a recovery expert, your physical therapist, because this is the integration back to high level activity. So this could mean golfing for you. This could be basketball, it could be softball, it could be anything else where you're starting to increase the intensity. Maybe you're walking faster, you're jogging faster, you're jogging more. You're going to the gym now, you're rolling in jiu-jitsu. All of these things require progressions, and you can't just listen to your body and how it feels. You still have to use the same cadence, the same structure of progressions that you need to gain mobility and control with a little bit of strength, develop bigger, stronger muscles in what we call hypertrophy mode, and then slowly get you back to that pinnacle. Well, that pinnacle happens around that 4, 5, and even 6 month mark in that second phase. For those who have been high level and been working with the same physical therapist the entire time, they might be able to be introduced to that same thing at month 10. That means that's exciting. So if you do this properly, you might be able to slowly get back to that high level physical activity at month 10. If you are starting from scratch on that second phase with a new physical therapist, you need to start slow, and I wouldn't push you at month 10 or 11. I would slow you down to month 12. The ideal world here is finding somebody that you trust and that is an expert that knows how to manage recovery after stem cells, so that way you can shorten the timeline, do it in a safe manner, and not have to worry. So if you're looking to get back to those high level activities and you're concerned about that second phase, if you've worked with that same provider, you've done an outstanding job around that 10-month mark, you're going to be so excited. For those who haven't and you're brand new to this, start with somebody, go conservative, and wait to that year mark to really be able to push yourself. And if you have been working with anyone on my team at the Stem Cell Recovery Experts, congratulations, you're on the right track. For those of you who have been stuck, not sure what to do, maybe when we're trying to work with someone else and you're not happy with the outcome or the results, start with a call to me and my team. The contact information is below. We'll analyze your recovery process. We'll be able to answer any questions that you have about what the future holds, what the best direction for yourself is, and to see if we can help. So it all starts at that phone call. We're excited to chat and point you in that right direction after your second phase to the pinnacle of your health. Congratulations, and we'll talk to you soon. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on recovering safely to create long-lasting results after stem cell therapy. Thanks, and I'll see you soon.